would like to talk with you all about integrated care pathways and how they can help in adoption or even in promotion of immunotherapy. Dr. Bousquet?
Well, very simple. What we need, there are 100 million people with allergic rhinitis in Europe, and possibly 5 million need immunotherapy. Only 500,000 get immunotherapy, 1 million get immunotherapy today, and 50% of them do not need immunotherapy. So first of all, you need to identify the patient who will need immunotherapy by stratification. Stratification may be simple. We have a system. That is to say, during the pollen season, the patient records the medications taken in 23 countries and the level of symptoms. But what you see many times is non-adherence to treatment. You took your treatment when you were not well. You never took your treatment when you were well. Isn't it the case?
Yeah, I started actually some weeks before the normal pollen season started, in order to get it on a decent level, to be a bit ahead of the.
Really?
Yeah.
That's wonderful. It's the first time I can see that in my life.
And I took it during 4 months, let's say beginning of April, starting till the end of July, something like this.
That's remarkable. I can tell you that in 25,000 people across the world, this never happens. At least with the cell phone approach. But you're a unique person and you know it.
He's a true ambassador.
Okay, so first of all, you need to show to the doctor what were the symptoms, daily symptoms during the pollen season, with the level of treatment and the level of control and the adherence. If you have severe symptoms like you had for the entire pollen season, then you can go immediately to immunotherapy. So you shorten the time to immunotherapy instead of 40 years to only 2 years or 1 year. And this is absolutely essential. So you need to identify and stratify the right patient who will need immunotherapy using digital health. And then you need to shorten the time between first symptoms and immunotherapy. And this is care pathways. But the care pathways integrate self-management strategies, because you took many medications as you wanted, and they were sometimes inducing sleep, but they were not effective. So self-management was not sufficient in your case. Then you went to the pharmacist, who was not aware of that, and then there is a need to integrate the pharmacist into the care pathway. Then you go to the GP, who was not very good. You didn't go to the internet because it was too early in your life, but now people go to internet. And then you go to the specialist who is prescribing immunotherapy. But if you come with an objective measure, that is a piece of paper showing these are my symptoms, this is what I've taken, then the doctor can prescribe immunotherapy after the first season.
Dr. Canonica, what is your opinion about the integrated care pathways?
Well, I totally agree, and I think that some of the points that were mentioned before should be critical parts of the integrated care pathway. For instance, one of the more difficult step that was mentioned by all of us was adherence to treatment. So it's difficult to define, not control a disease, mainly a chronic disease, and we are talking about, in any case, chronic diseases, if there is no adherence to treatment. And let me shock you. As far as the official data for adherence to treatment to inhaled therapy in Italy, for asthma and COPD, this data is coming from the Ministry of Health, the adherence is 13.8%. So if you look at the other side of the coin, that means that 84% of the people is not taking medicine, which is not the case, of course, of the seasonal rhinitis, of course, because the symptoms are there. The point is that is not an easy solution to increase adherence, but is, in my mind, is mandatory first to increase adherence. And this can be done just improving the partnership. I'm not just talking about education. I'm talking about partnership with the patients. Because, I mean, also talking about the costs of the disease. The cost of non-adherence is awful. And, I mean, we should working on this in terms of education and partnership. And just to finish about immunotherapy, Claus Bachert mentioned something that is crucial. We shouldn't take the data coming from the clinical trial. Why? Because adherence is very high. And in some cases, when we are claiming that immunotherapy is not working in clinical practice, but we don't know what's the adherence to treatment. And let me tell you that in some cases, it's even less than the usual pharmacological treatment.